next guest is a clinical psychologist and certified sex therapist practicing in Minneapolis, Minnesota. She specializes in sexual health issues such as low sexual desire, libido mismatches in relationships, arousal difficulties, orgasm difficulties, and sexual pain. She is also trained in Gottman Method couples therapy to help people improve their relationships. We are so happy to have you on, Dr. Lauren Fogel Mercy.
Oh, thank you so
Yay.
much for having me.
Thank you for being here.
I'm
We chatted
excited.
a little bit before this, and I am like, I think I'm the most excited for this conversation for myself.
She's like, I have lots of questions about my personal issues.
So,
Let's bring it on.
usually we go into the, how did you get into this? But I thought maybe we could just like, what is your favorite part about your job right now?
I think the most rewarding part, and it's been that way from the beginning for me, is just watching people make progress. And unfortunately, that's not always the case. Some people, if it's not the right fit for them or they need a different approach, certainly that happens. But watching people make progress and seeing those aha moments in real time is just so rewarding and so fulfilling, and getting to bear witness to that is just so much a privilege for me that I really just I find it really, it reinforces all the work that I put into the work that I do.
I love that. I think both Jared and I have a lot of struggle and trauma in this area.
Mm, mhm.
Sex has always been an issue in all of my relationships because of trauma. So I want to get into just kind of some basic questions so our listeners can learn, and then we'll maybe we can share some of our own struggles too.
Yeah, then we'll hijack the interview just so that we can get some answers to what we need to work on.
So, can you explain to us the Gottman theory that you use to work with your clients?
Mhm. I really want you to explain the four horsemen, and I'm going to watch Leanna's face as you do it because, like,
Okay.
I'm a little familiar and she's not, so I can't wait.
Okay, yeah. So the Gottman Method is an approach to couples therapy or relationship therapy that was founded by doctors John and Julie Gottman. So that's where the Gottman name comes from. And it's one of the evidence based approaches to partner and couples therapy. And it's based on a lot of John Gottman's research over 40 plus years, both research with couples from sessions and also in a laboratory setting, hooking people up to equipment, measuring their physiology. It's a really complex research process that he's undergone over several years, over decades. And so, what he's found through his research is just fascinating. And he's famous for this concept that you mentioned, Jared, called the four horsemen, which is these four relational patterns that can emerge in relationships that, if not sort of, reined in, can wreak havoc. And he named them the four horsemen after a biblical reference. The four horsemen in the Bible is supposed to mean like the sign of the end of times. And
Mm,
so the four horsemen in relationships is this sign of, we're not going in maybe the best direction and we need to kind of recalibrate.
mm,
So the four horsemen are these patterns, one being defensiveness. The second one is contempt. These are in no particular order. They're ordered so many different ways when you see them online or you read about them. Um, the third one is criticism, and the fourth is stonewalling. And so these are things that I like to clarify that, like, if you do this once in a while, that does not necessarily mean that your relationship is doomed. However, it might be something that you need to work on or improve, because if you continue to use that over time, it erodes trust and fondness in a relationship.
Mhm.
Mm.
So I can go into those a little bit more in depth to kind of say
Yes, please.
more about them. So
Yes.
now I have to remember which order I said them in. The first one
Okay,
is
the first was
defensiveness.
defensiveness. Yeah.
Yes. So defensiveness is basically, it emerges often when you feel like you're being attacked or criticized. And so it's this sort of defensive move to, um, defend your position, defend your character. And it often can come up as like, yeah, but, and you start talking about what your intent was, what your position is, what your perspective is. The trouble with defensiveness is it often is a response to a partner bringing something up to you, whether that's a complaint, whether it's a criticism, whether it's, hey, my feelings are hurt about something. So when we use defensiveness, what it's basically doing is diverting the conversation away from the original speaker and then making it more about you and your
Yeah.
feelings and your intent and your thoughts. And so that can really derail connection and attunement, because then the person who brought up whatever they were bringing up no longer feels heard or listened to.
Mm.
So would this? Oh, sorry. No, I was just like, would this look like, someone's like, hey, when you said this the other day, or when I didn't hear from you, like that hurt my feelings and it made me anxious. And then defensiveness would be the other person's like, well, 2 days ago you said this, and like, I'm always doing this, this, and that. So it's kind of like that deflecting and.
Yeah. Or minimizing, like, yeah, but I've been really busy lately, and it's, I can't help it, and I need you to be
Mhm.
more understanding of that, and da da da. And there may be some truth to that, and there may be something that you need to share back, but that may not be the time to bring that up, because I think of it as like a volleyball. Like, they're volleying to you to acknowledge something, to empathize with something, to hear them. And when you start going into your stuff, it takes away from that. So
Mhm.
the what you want to do first, and there's an antidote to each of these things. So the antidote to defensiveness is to take some responsibility, which can be really hard for people, especially if they feel like what their partner is bringing to them doesn't feel fair, or they have a totally different perspective. They may struggle to, take some responsibility. But if there's even a modicum of truth or something you can understand about what the speaker was sharing with you, you're right, I wasn't as available the other day, or you're right, I didn't show up on time, or you're right, I haven't been paying as much attention to you. Start there before you start going into here's what's going on and here's why and all of that, because that will help the speaker who's bringing up the complaint or the concern to feel like you heard them.
Mm.
Mhm. So,
Oh, I love that.
well, and I'm curious. I know this is out of order a little
It's
bit,
okay.
but what's the difference between that and stonewalling? Because those seem kind of closely related to me.
I do often think of like defensiveness as stonewalling are sort of a pair, and criticism and contempt are a pair. They're not
Mm.
Mhm.
always, but there are some flavors to those two that sort of stand out and sort of divide them. Um, so stonewalling is when, often when you're physiologically feeling flooded, which is the Gottman's term for feeling very overwhelmed and starting to enter sort of that fight, flight, or freeze mode. It's often a freeze response where you just sort of shut down,
Mm.
where you can become unresponsive, where you turn away, when you stop giving eye contact, when you stop responding. It can also be a flee response where you get up and leave, where
Mm.
you walk
Mm.
out, when you walk away. Usually that's happening because your nervous system threat detector is going off saying, this feels threatening to me. I need to get away from it, either physically or emotionally shut it down. Now,
So, like, sorry, like one word answers kind of thing, or someone's like, well, hey, can you tell me how you feel about what I just said? And it's like, I don't know,
yeah,
whatever, or like that kind of
fine.
thing, just totally flat. Yeah.
Yeah. It could be, crossing your arms and looking away, looking down, hunching over, just really no longer engaging. It's disconnecting and disengaging. And
Mm.
Mm.
often that's serving a purpose. It's trying to protect you.
Mhm.
And we often, unfortunately, can perceive threat in our relationships emotionally, sort of the
Mhm.
same way we would perceive threats historically, back in cave dwelling days with bears showing up and predators and this, like, it all sort of filters the same way through our nervous system. So threat is just seen as threat. Now, hopefully this, a lot of this content that we're talking about doesn't apply to situations of physical violence or abuse cycles, things like that. That's a totally different sort of area. But for those who feel like there is general safety in their relationship, there can be times where those threat detectors go off that say, I need to get out of here, or I need to go protect myself from whatever's happening. So that's totally fair and valid that sometimes your system is going to flood. It's just overwhelming. You're just can't think straight. And so the antidote to stonewalling is to practice some self-soothing. And what that often looks like is taking a break. So when your physiology is running wild and you can't think clearly, and sort of that cognitive part of you is offline, it often helps to say, you know what, I need to take a little break here. And the recommendation is that a break lasts between 20 and 30 minutes, because though it may not always seem this way, it takes a little bit of time to recover when your alarm system goes off. We need time
Yeah.
to kind of regroup and rest and kind of gain our composure back.
Yeah, like for your pulse to slow down even, and your blood pressure, and your breathing kind of becomes more regulated and back to normal and stuff. Wow.
Exactly. What we know from some of the research from the Gottman Institute is that flooding signs are often a heart rate at about 100 beats per minute. If you're extremely athletic, your heart rate would be around 85 beats a minute. That starts to tell you that you're starting to elevate, because I think a resting heart rate is usually around the 65, 70, 75 mark.
Wow, that's amazing. Right. And so tell me if I'm wrong on this, Lauren, but I think so some of the Gottman like love lab stuff is they have couples sort of face a camera and have a conversation about something that's like an issue for them, and they can sort of, and by coding for like how many of the four horsemen they see in like a 3-minute clip or something like that, they can predict with like 93% accuracy like who's going to stay together and who's not.
Oh, wow.
Right.
That John Gottman he's famously known for, and I think his average is, because there's sort of two pieces. I think he promotes that, with about 90+% accuracy, he can predict which couple will stay together and which will eventually divorce from like a 15-minute clip in total. But within the first 3 minutes, what you're referring to, Jared, is that first 3 minutes predicts with 96% accuracy what the rest of the conversation is going to look like. So if you start off with, guns ablaze and you're fired up and you're critical and you're contemptuous, like that's where the conversation will go from there. It's not likely to just suddenly become respectful and calm and composed.
Well, and I share that just because I think it's super cool, but also because when I picture like that, and what you just said about the heart rate is amazing to me, like how powerful our emotions are tied to our physiology. Like just sitting in a chair talking to someone, right? So you're not like jumping up and down and waving your arms and yelling, but just by talking about a topic that agitates you, or and that getting flooded, getting overwhelmed with emotions, like can just jack your heart rate like that.
Well, and I like very recently got out of a relationship. I think my heart rate is up right
Mm.
now. Like even just as you're talking, like thinking about conversations and fights, and like, I mean, I've been in kind of flight mode ever since the breakup. I'm having a hard time really like calming down, but I think I need to get a heart rate monitor.
Well, what's interesting, and COVID has really changed the whole way that I do therapy, because it's online now, and I know that there are ways to get around this. I haven't implemented it yet, but when I would have couples in my office with me physically back, a year ago plus, we would hook them up, and this is part of the Gottman method. You'll often get hooked up to a pulse oximeter, so those little doodads that just go on your
Yeah.
Wow.
doctor's office. They're cheap to buy. You can buy them, well, relative. They're like $20 each, so about $40 a pair. And you can buy them, online. And what they do is they measure two things. They measure your beats per minute with your heart rate, and then they also measure your blood oxygen. So that I think it's SpO2.
Mhm.
And so what that's telling us is two things: what your heart rate is doing, and also how much oxygen you're getting into your blood and your body. And
Mm.
so when people are like holding their breath, they're not
Mm.
breathing, they're more agitated, sometimes that oxygen level will go down. And so we will set it so that the system will or the device will beep when it gets to 100 beats a minute. It'll beep when your blood oxygen goes below 95%, so that we can slow down the pace and
Mm.
help to kind of regulate the discussion. Because if you're trying to push through when your physiology is shutting down, it's like just hitting a wall.
I have a question, but I'm going to save it. I'm going to save it until after you go through the other two.
Okay. Okay.
Okay.
Write it down. Don't forget.
Yeah, write it down. Remember it.
Okay.
So the other two are contempt, which is, actually, I want to reverse this. Let's talk about criticism first, because I think contempt comes sort of after criticism, makes it a little
Mm.
easier to understand. So I'm going to reverse order and say criticism is often when you are kind of going after the other person's character. This might come out as blame. They may feel attacked. Criticism and defensiveness often go hand in hand. So one person is being critical, the other person gets defensive. That's a common dynamic that we'll see.
Mm.
Criticism, I like to point out, is different than something that we call as more of like a complaint. So, because it's like, well, what if I'm upset about something? What if I have, a genuine gripe about something? Well, what am I supposed to do? So there's a difference between criticism and a complaint. Criticism is going after more of somebody's character, like, oh, you're so lazy, or like, why can't you just get it together, or this kind of thing. Um, you always do this, you never do that. Always and never are clues that there's
Mm.
probably criticism embedded in there, versus a complaint, which is more about behavior. It's more about like, this is bothering me.
Mhm.
When shoes are left at the front door, that bothers me. I worry that somebody's going to trip. It creates an eyesore for me. Like, it just makes me anxious. Can we move the shoes? Is really different. That would be more of a complaint. Versus criticism would be like, why do you always leave shoes at the front door? That bothers me. I don't understand why you keep doing that.
Mm.
Mm.
That's
Okay.
criticism.
Okay.
Mhm. Mhm.
That makes sense.
So the antidote to this, and this sort of goes along with the first 3 minutes of dialogue sort of statistic predicting the rest, we want to soften our startup, have a gentler startup. So that means that when you're bringing something up, when you're starting the conversation, you want to try to do that more gently.
Mm.
So often that might sound like, here's how it, and this goes into sort of the psychology speak, like, here's how I feel, and here's what's, contributing to that, and here's what I need from you. That tends to be a bit gentler and softer, makes it a little bit easier for people to hear that and to respond.